Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Franklyn Rocha. He is a neurohospitalist and clinical neurophysiologist. Today's Kevin MD article is Missing Prescription, Long-Term Parental Leave for Fathers in Medicine. Franklyn, welcome to the show.
Hi, Kevin. Thank you for inviting me.
All right, so tell us what led you to write this article on Kevin MD in the first place.
I got inspired by this book, The Expectant Father. So a colleague of mine actually recommended it. And I started reading a few of the pages, and I was really startled by the statistics about how very few men take parental leave. And I then decided to go to my mentor, and it's like, has anybody written about this? And I did a search. Nobody had written about it. And I decided, since I was in parental leave, that I wanted to, kind of talk about this topic.
All right, so tell us about the article itself for those who didn't get a chance to read it.
Yeah, so I kind of start off providing some statistics about how many dads and fathers take parental leave, and I was surprised to see that most people don't take any leave at all, or if they do, it's about 2 weeks. And as I don't know, a lot of the audience, for those who have had children, 2 weeks is definitely not enough to take care of a newborn, especially if you want to be a supportive spouse. So I delve into it, and a lot of it had to do with the fact that there's just this culture where fathers or dads, are supposed to go back to work immediately after they have their children. And as many of you know, the United States is one of the few countries that doesn't provide paid maternity leave or paternity leave. It's really up to the employer. And I delved into it even more, and even if parental leave is offered, a lot of fathers decide not to take it because of that culture of you have to go back to work and be productive. And the problem with that is that the children will feel the effect. Mm-hmm. The children really, the research really shows that fathers that are more available and that spend more time with their children, there's more bonding, and also there's a better relationship with the spouse, because moms really appreciate it when dad is involved. So I was like, yeah, I really need to talk about this. And then I kind of took those statistics and then applied it to my own personal experience as I was going through my training and residency and fellowship. And I noticed that a lot of dads didn't have a lot of time off to take care of their newborn, even when they requested it in advance. So I just saw, I need to speak about this. I think this topic is very important. And then, my mentor, Dr. Andrew Wilner, told me, yeah, I actually was thinking about writing an article about that years ago. So I'm glad you're taking this over. And he suggested that I submit this to you, to KevinMD and to the audience, and that it will be well received by a lot of the physicians who will be listening to this podcast.
All right. So, yes, I know Andrew Wilner well. He's appeared on a podcast multiple times. So, thank you so much for sharing your story. You mentioned that you yourself was on parental leave. Now, did you run into some of those obstacles when you were requesting your own parental leave?
So, I'm in a different situation because I'm actually 100% self-employed. So, I'm not really particularly employed full-time by any hospital system or office. So, a little background about myself, I finished my fellowship training in 2022, and just seeing my own supervisors and my colleagues who work full time, I really didn't want to practice medicine the way that it's practiced now, which is, you get employed and then they give you as many patients as possible, to see as many patients as possible in very little time, and with a lot of administrative burdens and just really no control on your time. You just have your PTO, which is your vacation, X amount of time a year. And I just wanted to practice differently. I wanted control of my schedule. So one of the benefits of me doing locum tenens / clinical neurophysiology / some teaching gigs here and there is that I get to control my schedule. Mm. So I decided, I put my vacation settings on my email, and I said, I'm leaving from this date to this date. And that's it, I'm having my first child, and I need that protected time. So I actually designed my schedule in a way that I was able to take 3 months off from work
Mhm.
and make sure everything was tidied up before I leave, and make sure that I had enough savings to be able to go through this with no problem. So it required a little bit of planning, but I was able to circumvent all these challenges. However, if I was an employed physician, I would think I would have the same problems where probably they would tell me to come back to work or pressure me to come back to work as soon as possible. And I do have to say something really interesting is that I have been pressured by my, contracts, the hospital system that I contract with to come back to work. They've been sending emails since January. Now I've been like, nope, I'm holding off. I'm not coming back till March. So the pressure is there. It's just that I decided I wasn't going to give in and that I was going to prioritize my son, being that he is the most important thing right now for me, besides my wife, of course, supporting my wife. But it's important that we obviously prioritize what's important for
Mhm.
us. And, the work is going to be there 2 months down the line, 3 months down the line. Like clinical medicine, the work is exhausting, it's challenging. So I thought, for me, this is important. So I did the schedule, and I'm really happy. Honestly, this is the best thing I could have done.
So you mentioned that some of your contracts are pressuring you via emails. Just give us a gist of what are they saying? How are they pressuring you?
Well, some of them are saying, "Are you like going to come back to work with us? Are you ever going to come back?" I'm like, "Yes, I'm I'm in parental leave. If I haven't emailed you back, it's because I'm still taking my time." I'm like, "Oh, it's okay. Just wanted to make sure."
Okay.
And then some of them would be like, "Oh, we're ready to put new cases on your log, Dr. Rocha. When are you expected to come back?" Those are some of the emails I've received. But of course, you have to just not give in to the temptation of wanting rushing back to work, and just remembering why, I did this in the first place.
Now, just to be clear, in most employed settings, if a father wants to take that parental time off, normally it comes out of their PTO, their paid time off. Is that your understanding as well?
Yes, or even worse, for some institutions, because if you haven't been working for more than a certain amount of time, let's say like a year or 2 years, in some institutions, if you just recently switched jobs, you actually would have to take unpaid time off, because they'd be like, "Oh, you haven't been with us more than 12 months or 24 months," and so a lot of families actually have to take unpaid time off, which is unfortunate, right? Because we give all this time to this career, we give our years of our life to train, and you would expect that at one point the system has your back, but what I've found is that at the end of the day, they just care about just covering their shifts. So it's up to us. We really have to just empower ourselves to be really like, no, I need this time. Like, you have to give me this time because this is important for me. This is important for my family. And it's also a thing about mental health, right? If you don't
Mhm.
have that time off to take care of your child, then you're gonna feel some kind of resentment towards your job. So it's it's a dynamic, it's a conversation that I think people just have to have with their employers if they're employed, and if they're self-employed like me, then setting those boundaries is very important.
You mentioned earlier that when you were talking to some of your colleagues, even if they requested that parental time off in advance, they ended up not getting it. Tell us about some of the stories that you're hearing about fathers in medicine, in employed settings, not getting that time off at all, and some of the pushback that they're getting from their employers.
Yeah, actually, I was talking to one of my other friends in Texas. I'm not going to disclose who the employer
Yeah.
is, but uh, he was telling me that he wanted to take time off. He had just had a little girl, and he couldn't because he had just started at that job very, very recently. So they told him that he actually couldn't take a single day off unless he wanted to take unpaid leave. And he honestly gave in to the pressure of just continuing to work. daughter was born on a Friday. He went back to work on a Monday, and I just felt really bad because I was like, this is just not fair. Like you're a first time father, and he's kind of on the older side, older than me, and I'm not going to say my age here, but he's a first time father, and I just feel bad that he wasn't. I mean, he could have put more pushback, of course. I mean, that's always an option, but I think he just went back to work, and then going back to my experiences as a trainee, when I was a resident, I had a junior resident who also had a baby, and I believe they gave him 2 weeks total for parental leave. And he was in one of the toughest years of neurology. That's
Yeah,
PY2, PY3, where you're doing like a lot of call, a lot of consults. So he had to do 2 weeks and then go back to work. And his wife was also a resident in internal medicine. She got 6 months,
sure.
or 6 months, or 3 months. No, I don't remember. I don't think it was 6 months actually. It's probably like 3 months. So
Hmm.
she got 3 months. But that's the thing that I kind of want to highlight, and I highlighted in this article, is that there's this really disparity between the leave that a father gets versus a mother gets, right? And of course, we understand that the mother is very important. She's the one that's feeding the baby, and she's probably the one spending more time with the baby. But what I'm saying in this article, my message is, we really need to close that gap of the time that's given to dad versus mom. I mean, we live in an era of equality, right? Of trying to, you know, close the gap
Hmm.
in different aspects of society, including, the pay of women's pay. Also, we need to close that gap. But I mean, this is what I wanted to kind of bring. The point that I wanted to bring is that fathers and dads deserve time off too, more time off than the 2 weeks, because the newborn, the most challenging phase I found, and my son is 3 months old right now. And February 24th is going to be three months. And these first 3 months are very challenging because it's known as the fourth trimester.
Yeah.
The baby is coming out. It still thinks it's in the uterus. They cry a lot. They feed a lot. They need a lot of, they need stimulation. So it's a full-time job, and it's not a one-person job, even a two-person job.
Yeah.
And me and my wife are both on leave, and we're like around the clock busy during the day because it does take a lot of time and dedication to take care of a baby, in an appropriate way, right? So
So, what are some ideas that you have to maybe change that culture of medicine to be more accepting and embrace paternal leave?
I mean, I think we first we have the conversation like we're having today, and that's why I decided to write about it and see if people are willing to kind of comment about this and see what dads think about this, what moms think about this. So have a conversation in a safe space. And then second of all, we might need to just change a little bit the policies and procedures of some of these employers and make sure that parental leave for fathers is the time is extended a little bit more. Maybe a conversation can happen that we include those in contract benefits and non-salary benefits and make sure that parental leave is emphasized. Of course, at the federal and state level, we do advocacy efforts, although that's a little bit more difficult, of course, but the United States is still one of the few nations that doesn't give parental leave, like paid parental leave guaranteed as a right, while the other countries do. And and the thing is, like, from their side, you can be like, oh well, we can't afford you being on leave, but on the flip side, you say, well, the research is really clear that happy couples who have children, if they take that time off, they're more productive when they come back. They are more refreshed, whatever you want to call it. So it actually ends up, from a business perspective, it ends up making sense to change those policy procedures. And then I guess the third thing also is that we have to go back also in the training and the culture of medicine. And we need to change that mindset that we need
Hmm.
to sacrifice ourselves, and put ourselves last. When really the research and the anecdotes out there is that this martyr, um, culture of medicine is not good for patients. If the doctor is not happy, If the doctor feels resentful, they're not going to provide good patient care.
Mm.
So we really need to kind of also rethink this culture of medicine of productivity and think about, well, how is that going to impact my work with patients? And if I'm not happy, I won't be able, how am I going to be able to deliver good patient care? So at the end of the day, it's a win-win situation for everybody if we give parental leave to men and women equally.
We're talking to Franklyn Rocha. He's a neurohospitalist and clinical neurophysiologist. Today's Kevin MD article is Missing Prescription, Long-Term Parental Leave for Fathers in Medicine. Franklyn, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Well, take-home message is I do recommend for all the trainees that are out there or anybody who's considering kind of, switching things up is just become self-employed, become an independent contractor, open your own S corp, your own small business, become an entrepreneur. I say this because that was the only way I was able to schedule these 3 months of paternity leave. So if you're kind of tired of just the day-to-day routine and feel like you're in this rat race, I mean, just take a risk and decide that you want to work for yourself. There's a lot of side gigs now with
Mm.
technology. I think it's an excellent way to kind of make your own schedule and break away from this culture of medicine that you have to just work yourself to the ground. You know, since I decided to be self-employed and do this, I've never been happier. So if anybody has any questions, of course, Kevin can pass my email if you have questions about my career trajectory. I did it straight out of fellowship. I don't think everybody has to do it that way, but I can at least give some tips on how I was able to do it.
Franklyn, thank you so much for sharing your story time and insight, and thanks again for coming on the show.
Thank you. Thank you.